Hello. So as a young medical student or a medical resident, if you get a patient who comes to you with an ANA positive report, does that always mean that the patient has lupus? Well, think again. ANA is anti-nuclear antibody. How do we test for it? We test for it by doing an immunofluorescence assay using the Hep2 line. Now, if someone has ANA positivity, that only tells us that there are antibodies targeting some part of the nucleus. We of course need to see this in context of the patient's symptoms, but just talking about the test, if you get an ANA positive, look at two things. One, what is the titer of ANA and what is the pattern of ANA. Titer of ANA is typically reported as 1:100, 1:320, 1:640 and beyond. Anything which is more than 1:320 and beyond is important. Also, we are looking for patterns. For example, a homogeneous pattern is very likely to be suggesting of lupus in the right context. Similarly, there could be speckled pattern, there could be a centromere pattern and so on. Now, if I get an ANA positive, we need to investigate further by doing what is known as an ANA blot assay. That is going to technically break down the nucleus and see all the important antigens within it, like we are going to look for anti-dsDNA, anti-Smith, UNRNP, Rho, La and so on and so forth. And positivity of each of them is going to connect with different types of diseases. For example, an anti-centromere is systemic sclerosis. Anti-dsDNA, anti-Smith is classically lupus. Similarly, anti-Rho and anti-La could be lupus, but it could also be Sjogren syndrome. So, just a positive ANA does not tell you lupus. At the best, it is hinting towards a possibility of a connective tissue disease, and we need to look at the clinical context and the ANA blot assay to identify which disease it is. Not always lupus. Of course, it could be lupus, but it's not always lupus. I hope that helps.